Dry eyes? What can you do to treat them? Dr. Chebil is here to tell us. I'm Anita, and this is Care Experts. Today we're talking about dry eyes with Dr. Alexandra Chebil, a Harvard-trained board-certified ophthalmologist with LASIK Center Medical Group. Thank you so much for joining us, Dr. Chebil.
Thank you for having me, Anita.
So talk to me about dry eyes. What exactly are the symptoms of dry eyes?
When you have a dry eye, it can start initially with blurry vision or fluctuating vision. So it can be clear one time of the day, get blurry throughout the day, depending on how much computer vision you're using, how much you're using your cell phone, how much you're blinking. So initially, blurry vision. You don't think of it as being dry eye until you actually feel like your eyes are dry, sandy, gritty, red, irritated. Those are also indications of a dry eye.
What exactly causes the dry eyes?
It can be a variety of factors. Tears are in two different categories. There is the water part of a tear called the aqueous production. So if your tear gland is not producing enough of this watery tear, then the water just it's not there and your eyes are dry. The other most important factor in maintaining moisture in your eyes is the lubricating layer, which is formed by the glands in your eyelid, the meibomian glands. So if you don't have this oily layer that's holding the water on your eye can become dry. It's called evaporative dry eye. So there are two different factors, and you have to figure out what the issue is. Are you lacking moisture? Or are you lacking the lubricating layer?
So is there a medical procedure to figure this out? Like if you had dry eyes, how would you test them for this?
Well, when you first go in to see your ophthalmologist, if you do feel that you have gritty eyes, they're red, they're sandy, you go and have them checked. And there's certain tests that can be done in the office. They're standard tests. One of them is called a Schirmer test. And they're little pieces of filter paper that are put in the bottom of your eyelid, and they measure how much fluid is draining out of your eye. So if your eye doesn't have enough moisture to keep these little paper, it's kind of an odd test. It's not really comfortable. But
yeah, I imagine
right away,
it sounds having something in your eye.
You're blinking and the tissue's hanging off there. But that'll tell you if your eye is dry or not, if there's not enough moisture there. If you're looking at the other factor, which is the evaporative factor of the dryness, it's called a breakup time, tear breakup time. When you blink, the tears have to stay on your eye. It's kind of like a windshield wiper. They smooth your eye, and then when you open it, the moisture has to stay there for a minimum of 10 seconds. If the tear breakup time is less than 10 seconds, then the moisture's not staying there. So those are the,
That's
and there are other tests that can be done. If your tears are very thick and concentrated, the osmolarity can be measured to see if there's too much salt in your tears. And these are all like complicated tests, but most of the time it's the breakup time. The blue dye test will show if there's any dry factors, if your eye has other patches where there's not enough moisture in them.
Now, can dry eyes cause permanent damage to your eyesight or your eye health?
Unless you have a problem such as Sjogren's syndrome or rheumatoid arthritis, that can cause permanent damage to the eye as far as being severely dry. But most of the time, if it's just the discomfort, the redness, the grittiness, that can be addressed with conservative issues.
And why do our eyes tend to get drier as we age?
If you're a female over the age of 50 and hormones are dropping, those are the three main reasons why your eyes can become dry. Also, if you're doing a lot of computer work, who doesn't?
Yeah.
You don't blink as much and your eyes can become dry. It's also a nutritional factor. Omega-3s can help your eyes stay moist, reduce the risk of dryness. So before you get into any kind of medical treatment for dryness, you need to address environmental issues like fans, air conditioning, heating, desk heaters that are blowing on your eyes. All of those things can cause your eye to be dry. Living in the desert. So all these factors can cause your eyes to be dry.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on dry eyes. Now, you mentioned a number of things we can do, and it sounds like a lot of them have to do with lifestyle, but is there anything else we should keep in mind that we could maybe do to help prevent our eyes getting dry as we age?
Blinking is a big factor, so that's the lifestyle. If you have older people that have a CPAP machine for breathing issues at night, a sleep apnea, if you have a mask that is not fitting properly, over time as you use the machine, all that air is blowing on your eyes, causing them to be dry. You can do other things like lubricating drops. You can have a sleep mask. If your eyes are dry overnight, then you can put a sleep mask on to keep moisture in your eyes and turn any kind of air conditioner or heating away from your eyes so it's not blowing right on your face.
And how would you treat dry eyes medically?
First of all, you have to go and check with your ophthalmologist to make sure that you actually have dry eye, because you don't want to, obviously the normal reflex is just go to the drugstore and buy some lubricating drops. But you may need more than that. If your eye dryness is caused by the glands, they're not producing enough oil, you may need to have a treatment to treat the glands, to express the oil from the glands. But if you're doing the conservative measurements and your eye doctor says you need eye drops, lubricating drops, that's where you get into the whole menu of different drops and what you need, what type of drop, how thick, and how long they're going to last.
So I know you've mentioned, obviously, there's these drops, there's these lifestyles. So these would be ways that you can treat dry eyes naturally, correct?
Correct.
Just lifestyle changes and possibly
diet.
drops. Diet. If you had to get a medical procedure, how invasive is that?
The eye drops, we'll start with the eye drops. So the non-prescription drops, I prefer the non-preserved kind if you're going to be using them a lot. There are prescription drops, which contain cyclosporin, which are Restasis, and Cequa and Xiidra. These are drops that are prescribed by your eye provider to make your eye produce more tears naturally. If you have a problem with the meibomian glands that are blocked up, they've got too much oil in them, then you'd have to see your eye care provider for different treatments, ultrasonically and heat treatments, warm compresses. That's another issue. That's something that you can do at home to keep your eyelids moist, and also very clean, removing eye makeup at nighttime and staying away from toxins in the environment.
And what would you say the average cost is to do some of these procedures to prevent dry eyes?
A lot of times it's covered by insurance. If not, then CareCredit credit card can help with any type of long-term financing.
So now it's time to do something a little fun called myth or fact. So I'm going to ask you 3 questions and you can tell me if these are myth or facts. Okay. So the first one, myth or fact, only dry air can cause dry eyes.
Myth. A lot of things can cause dry eyes. It's your nutrition, it's your environment, it's the blink reflex. So they're all different factors that we have to address. And also the meibomian glands. You could have blocked eyelid glands, and it's an easy fix.
Oh, got it. So myth or fact, the only solution for dry eyes is eye drops.
Myth. There are lots of eye drops. We start with that initially. Lifestyle changes, diet changes, and there's also new nose spray that has come out, Tirvia. And that is a nose spray that makes your eye produce more tears without actually having to put drops in your eyes.
Oh, wow.
So that's something new.
Yeah, all sorts of things out there. So myth or fact, all drops are created equal?
Absolutely no. Myth, for sure, myth. Every single drop has a different composition to it. They come in very watery type drops that are not going to last too long if you're just starting to have a dry eye. And they become thicker and thicker. Certain drops will last more time than others. They even come in a gel form and an ointment that you can use at nighttime in case your eyelids don't close properly at night. And that fixes a problem of morning dryness.
Well, it sounds to me like a great way to prevent dry eyes is just to keep up with your yearly annual ophthalmology appointments and make sure that you're healthy.
Very important.
Yeah. Well, thank you so much, Dr. Chebil, for giving us all that wonderful information on dry eyes.
You're very welcome.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.